From the Sabota, welcome to Medical Science because as a student of Medical Science, I want to talk about this branch of science. नमस्ते भाई टेन करो या अलिफ लाम मीम अल्लाह शफी तमाम hello my friend supporter medical science what is science science is anything any matter any event any problem any occurrence can solve by logic document data mathematical should be proven that is science. What is medical science? Medical science is the branch of science describe elaborated creation like human. In last lecture I see there is some problem occur in my chamber, the fair diagnostic complaint Dr. Mohammed Shujul chamber. Now I who do that kind of politics already punishment given. In case of my chamber, those are remain Dr. Juman, Dr. Professor Ripon Talukdar এবং Professor Lopan those are remain. No problem. Continue. In my chamber, if anything occur, next time anything occur, no action not taken. But in that type of activity is not considerable. Now I say my friend was about it. For that reason I say sorry and say sorry to one another. If you disturb me, how much patient can die? You know that? And those are my patient. If give right to alive, I will try my best if I remain. All over the world. Those are my pen supporter. And those are my patient. If you give me right in your document evidence, any situation, any accident, otherwise, you give money back after alive. If possible, if not possible, then consider no problem. Those are my personal patients. But by the name of Constable book is present. What is now medical science? In medical science, say equal more or less trillion cell human have. And human, how you control the BP? If reduce the BP, blood pressure, you can take sodium chloride, blood pressure. If blood pressure is high, no. Now what you take it? In hypertonic solution, what happens? And hypotonic solution. How control the hypertonic and hypotonic solution in BP? If pressure high, low, you take saline, pressure will be correct. If pressure high, you avoid salt. Hypotonic solution and hypertonic solution. Hypotonic solution, what happens? In cell remain normotonic solution, 0.9% sodium chloride solution. In outer environment, 0.5% sodium chloride solution. Now in hypotonic solution, what happens? In hypotonic solution, what happens? The fluid remain. Cell membrane. In hypotonic solution, what happens? In cell non-motor 0.9% sodium chloride, 0.5% sodium chloride outside. Then the cell swell to a tonical balance, outer water enter into the cell swell. If cell swell, what happens? If blood pressure high, the blood volume reduce. If blood volume reduce in hypotonic solution, blood volume reduce, blood pressure low. In hypertonic solution, what happens? Blood The cell in hypertonic solution, whatever cell shrinkage, cell fluid go to the outside, and in urine, hypertonic solution in urine, the cell fluid go to the outside and urine go to the fluid. Then hypertonic solution, what happen? Blood pressure low. If blood pressure high, hypertonic solution, what happen? Blood pressure. Blood pressure. If blood pressure high, what happen? Cell, hypertonic solution, volume enter into cell, and blood volume reduce, blood pressure become normal. Hypertonic solution. If blood pressure high. In opposite, in hypertonic solution, if blood pressure low, if blood pressure high, hypertonic solution cool the blood pressure, reduce blood volume and blood pressure control. In hypertonic, in hypertonic solution, in hypertonic solution, blood pressure fall, then blood pressure rise. In hypertonic solution, what happen? 1% sodium chloride solution at 0.9%. What happen? The cell fluid outside to the blood volume and go to the urine. Work as a diuretic. Now what happen? In hypertonic solution, blood pressure it fall, it raise. Blood pressure raise. If blood pressure in hypertonic solution, what happen? Cell blood volume, cell swell, blood volume reduce, also pressure also reduce in hypertonic solution. In hypertonic solution, what happen? The blood pressure, if blood pressure is high in hypertonic, give hypertonic solution, what happen? Blood pressure become low. If blood pressure become low in hypertonic solution, blood pressure, if blood pressure low, hypertonic solution given, blood pressure can become normal. In hypertonic solution, blood pressure high, then blood pressure reduce. Sorry, in hypertonic solution, what happen? If blood pressure reduce, then come in normal. If blood pressure high, give to hypertonic solution, blood pressure come in normal. Now check up that is researchable. Fine. The mechanism is what is the mechanism? In hypertonic solution, for example 0.5% sodium chloride and cell 0.9% sodium chloride solution is normotonic isotonic solution. And cell remain 0.9% sodium chloride, outer environment 0.5% sodium chloride. Now what happens? The fluid enter into the cell swell, blood volume reduce, blood pressure also reduce. If volume reduce, blood pressure also. If blood pressure high, if give hypertonic solution, blood pressure reduce. If give hypertonic solution, what happen? The cell hypercell outside remain 1% sodium chloride, cell remain 0.9%. The cell shrinkage, fluid go to the outside, and what happen? If fluid go to the outside, what happen? If blood pressure low, become high. If high, give the hypertonic solution. If low, give the if blood pressure high, give the hypertonic solution. In hypertonic solution, what? Fluid go to the cell and blood pressure become normal. If hypertonic solution, what happen? Cell fluid enter into cell, blood pressure become normal. High blood pressure become normal. In low blood pressure, fluid in hypertonic solution, what happen? Fluid come out the cell. The blood pressure, low blood pressure become normal. Low blood pressure give the hypertonic solution, or high blood pressure give the hypotonic solution. Come in normal. By tonical balance, there is a experimental researchable. Already research when done, then you apply them. It is also by sodium tonical balance we can control blood pressure. That is the policy. Understand? For experimental 1% sodium chloride hypertonic sodium chloride solution and 0.5% for example hypotonic sodium chloride solution. What happen in blood pressure in patient? That is researchable. By type 1 blood pressure, in if type 4 blood pressure by drug 1 month by 6 month therapy blood drug, if heart every cell, epicardium, myocardium, endocardium remain normal, there is no block in heart, then blood pressure remain high, type 4 hypertension. If epicardium, myocardium, 80% of the cell, epicardium, myocardium remain normal, and coronary artery remain normal, then type 4 hypertension can be controlled. How you know that the heart by ECG, echocardiography, everything is normal, but blood pressure is high. Type 4 hypertension. Type 4 hypertension blood pressure controlled by calcium channel blocker. Calcium channel blocker. There is a heart alpha blocker, beta blocker, calcium channel blocker, diuretic. Alpha blocker, beta blocker, calcium channel blocker, diuretic, angiotensin converting enzyme, ACE inhibitor, angiotensin converting enzyme inhibitor, angiotensin receptor blocker. That is the policy of heart pressure. But by that policy, if you type 4 hypertension become a without drug, how can you come back without drug? Take drug. How become a normal? Any any heart specialist know that type 4 hypertension can be controlled. Reverse the drug, type 4 to type 3, type 2, type 1, then without drug can survive. We discuss elaborated about next class. How as a heart patient you without drug reverse the type 4 type hypertension to type 3, type 3 to type 2, type 2 to type 1, type 1 to type 1 to no drug. Without drug, how you can survive? Is it possible? Wait and see the lecture. Thank you very much, my friend. Water today is enough from medical science. Any heart specialist all over the world know that policy. Thank you very much, my friend. Water. In case of hypotonic solution, that is always researchable. Not do that. You see that. Then anyone not take risks. If you take risks, fall in danger. I am not responsible. My one and only tutorial not responsible. First check that. For checking, those are say for researchable hypotonic solution. What is that? Know that mechanism. In hypotonic solution, what happen? Cell swell. If cell swell, blood pressure reduce. High reduce. If cell blood pressure low, hypertonic solution, what happen? Cell shrinkage and blood volume increase. Blood pressure. If blood pressure low, become normal or high. Thank you very much, my professor. Today is enough from medical science class.